Ryan, we're going to start with you, and maybe just a couple of minutes on what is the Office of the National Coordinator? What do they do? And then, of course, what do you do? And then what's the state of the state there?
Sure thing. Thanks so much for having me. For those who don't know, the Office of the National Coordinator for Health IT is primarily charged with driving standards and programs that improve interoperability across the healthcare system. And we do that in a few ways. One, with the identification of standards that are adopted and ideally used by industry, primarily electronic health records vendors and developers of really a number of the supporting products that support those EHR vendors. And that kind of universe is expanding, especially since the pandemic. We can talk about that a little later. Two, we do that through policy coordination, primarily with CMS and CDC in terms of with CMS to make sure that the payment regulations and incentives are tied and correspond to the certification of health IT products. And then third is the coordination of this approach across our federal programs and partners to ensure that, for example, with the use of what's called FHIR standards, which are primarily and very prevalent in other industries, such as the financial services industry, that our programs across government are leveraging the latest innovations and not recreating the wheel. So for those who don't know, FHIR stands for Fast Healthcare Interoperability Resources, and we're seeing a really large uptick in the adoption and harmonization of FHIR standards across that certified health IT landscape. We are really proud in this calendar year to say that the 900 plus developers who are part of our program have attested to the new requirements and regulations that were introduced in approximately March 2020. There was a 2-year compliance timeline, and we had 100% attestation, which is pretty amazing. So that means that those developers have to attest that they are going to make that functionality available to providers, which includes clinicians, hospitals, health plans, federally qualified health centers, and increasingly more community-based health organizations. So that will really, we think, be a game changer in the future for true interoperability of healthcare. So that data moving seamlessly across different vendor platforms and different networks, which is, certainly a lofty goal, and there's some challenges and hiccups that we still have to work out. But it's pretty incredible patient empowerment and reduction of clinical burden from those two perspectives.